I read a quote that says, when a disease outbreak threatens countries around the world, which organization helps coordinate the international response? The answer is World Health Organization. The World Health Organization is the specialized agency of the United Nations responsible for international public health. The last devastating disease outbreaks was COVID-19, which started on December 31st, 2019 in Wuhan, China. The disease spread all over the world. As classmates, we should appreciate the fact that we are all beneficiaries of such vaccines as polio and tuberculosis, which are recommended by the World Health Organization that coordinates outbreak, spread, control, and treatment of all global diseases outbreak. I have, been vaccinated against influenza and COVID-19 in the past. Therefore, I'm a beneficiary of the services offered by the World Health Organization through the coordination of the international public health. Today, I want to talk to you about the background and functions of the World Health Organization, as well as its achievements. The background and history of the organization is important to humanity as it battles to control the various global diseases outbreak. Before talking to you about background and functions of the organization, I need to first tell you about its history. The background and history of the World Health Organization is important to the world. According to WHO, in April 1945, diplomats from around the world met to form the United Nations in San Francisco, California, United States of America. Representatives from Brazil and China proposed the establishment of an international health organization and a convention of the conference to frame its constitution. The W.H.O. constitution was adopted in 1946 but came into effect on April 7, 1948, when it was officially established after the 26th of the 61 governments who had signed it ratified its signature as per the Article 80 of the Constitution. This date is celebrated yearly as World Health Organization Day. Geneva, Switzerland, is the headquarters of WHO, which has a current membership of 194 states. WHO leads global efforts to expand universal health coverage, to promote healthier lives from pregnancy care through old age. The organization works with governments, health institutions, and international partners to lead and promote the highest possible level of health for all people, regardless of race, religion, beliefs, or economic status. This is done by directing policy, establishing health standards, and coordinating responses to health emergencies. According to the background of WHO, there are many core functions and achievements of the organization. The functions and achievements of World Health Organization. The World Health Organization discharges its core mandate through four major primary functions. First, the agency works to achieve universal health coverage through coordination of health emergencies by detection and response to acute health outbreaks and crises across the globe. Improve access and delivery of essential medicines and health products in fragile environments, and provide protective equipment for the management of infectious diseases. In addition, the organization gets global health standards, policies and guidelines, classification of the diseases, and vaccination protocols for new diseases. Public health standardizations assist countries in controlling communicable and non-communicable diseases. Further, the agency offers technical support to member countries in strengthening their healthcare systems, and tools development for control during outbreaks by training health professionals in the affected regions. Through collaboration with international organizations like CDC of the USA, World Health Organization carries out research, timely required data, analyzes them, and promptly publishes the global health statistics for comparison and critical decision making. Finally, monitoring and tracking health trends ensures future control and prevention outbreaks. WHO is currently involved in the Ebola outbreak in the central and eastern region of Africa. Despite multiple global programs and advanced research to control and eradicate Ebola, no vaccine to date has been produced. Achievements of the World Health Organization. On working together for health for all, WHO celebrated its 75 years of operations in 2023. For the elimination of diseases, World Health Organization in 1980 achieved its greatest milestone in medical history. Smallpox was eradicated, the first human disease to be eliminated globally. The disease was erased from the face of the world by historic combined efforts from the 194 member states with a single unifying vision: the attainment of the highest possible level of health for all people. Consistent mass immunization programs and efficient delivery of vaccine have reduced global polio cases by 99%. COVID-19 has been contained but not eliminated, and the release into the market of new vaccine for malaria prevention in 2023 has drastically reduced infant and maternal mortality rates. Expansion of HIV/AIDS and antiretroviral therapy has reduced global deaths and mother-to-child transmission. Through creation of framework Convention on Tobacco Control, WHO has realized steady decline in tobacco in 150 countries. Coordinated response to international emergencies and natural calamities like earthquakes and outbreak of infectious diseases have been promptly managed. Other achievements of WHO are treatment and control of tuberculosis, promotion of better public health worldwide, provision of technical assistance to member countries, and constantly monitoring global health trends. The agency has embraced the emergence of digital health and is currently working to ensure the safety and effectiveness of artificial intelligence for health. Prevention is better than cure. Through prompt vaccinations and provision of mosquito-treated nets, WHO has saved many lives across the globe. Given that today I covered the background, functions, and achievements of the World Health Organization, I would like to leave you with a quote from Pan American Health Organization. Health is not a cost, it's an investment. Any questions so far from the audience? No questions. Thank you.